Okay, so let's get started with the orthopedic evaluation for osteoarthritis-associated pain. So the first thing we're going to talk about is stance and posture. So the normal standing position in a dog, it should have a nice flat back, shouldn't be rounded, because a rounded back would suggest that weight is being shifted forward, is indicative of hind limb discomfort. The mani should be placed directly under the shoulder joint, and the pes should be positioned a little bit caudal to the line of the hip joint. And as dogs are standing, they should not be lifting the limb up and down. That would suggest that there may be discomfort somewhere in that limb. So one thing I like to do is observe the standing from the sitting position and how a dog then attains the sitting position. You'll see there that rise to the standing position was very smooth and powerful, and back to the sitting position with the limbs placed equally either side of the body, a nice square sitting position. And then you see that smooth return to the standing position. Lovely sitting position, and then coming to the standing position in a very easy way. So we've talked a little bit about stance and body position, but we also want to evaluate gait. Now, we're going to look at some video of gait in this studio. However, I want to emphasize that in most cases, my gait evaluation is done between the waiting room and the consulting room, just taking every opportunity to observe the important aspects of gait. Another thing you'll sometimes see with hip osteoarthritis is a rolling or a rocking of the hind limbs. So as you watch this golden retriever walk, one of the first things you see is the extraordinary side-to-side movement of the hips. That's because this dog has hip osteoarthritis and is trying to limit movement of the coxofemoral joint, but it still wants to walk forward. And in order to move forward, while limiting movement of the coxofemoral joint, the dog has to sway its hips from one side to the other and back again. And that's what you're seeing here as you watch this golden retriever walk up and down. Now let's look at the forelimb gait. And this is a little bit more difficult to detect, but as you watch this golden retriever walking up and down, you'll see a head nodding. As the head goes down, it's the right forelimb that's hitting the ground. What that means is that there is a predominantly left forelimb problem, because actually what's happening is the head is being lifted up and back as the left forelimb hits the ground, because that's the one where there's pain. And what we'll see later on during the examination is that we do indeed find left elbow pain and bilateral hip pain in this dog. So as we wrap things up here, I just want to emphasize a few points. Firstly, that the signs of joint pain can be subtle. They could be things such as the dog just stops panting, or closes its mouth, or just slightly raises its nose into the air. It could be that parts of the body tense up, or there's a slight withdrawal of the limb as you're manipulating the joint. Now, one of the reasons these signs of joint pain are subtle is because as we are performing the evaluation, it is impossible for us to reproduce the loading of a joint that occurs during locomotion. Just if you think about this for a moment, I have knee pain. And yet I could stand here or sit in a chair and have my joint passively extended and flexed without any joint pain. And yet I have joint pain as I walk downstairs. And the final point I want to emphasize is we should perform the orthopedic evaluation in whatever position the dog is most comfortable in, adhering to fear-free approaches. We should be performing the orthopedic evaluation wherever the dog is comfortable. We should meet them on their terms, and that will allow us to get much more information out of the evaluation. Thank you for joining me, and good luck with your orthopedic evaluations for osteoarthritis associated pain.